I'm Jim Masters, and welcome to Close Up Television. This is the show where we talk to today's top thinkers from all around the world to bring you information, inspiration, and thought-provoking ideas that you can put to use in your personal or professional life right now. Today we celebrate renowned infectious disease specialist, Dr. Vatsala Sastry. For over 30 years, she's specialized in the diagnosis and treatment of infectious diseases, also known as contagious or transmissible diseases, which are those that stem from a pathogen from a host organism. Recently, we had an opportunity to visit with Dr. Sastry and her team on location at her medical practice at Brooksville, Florida, just outside Tampa.
Good morning. My name is Dr. Vatsala Sastry. I'm board certified in infectious diseases. I'm board certified in internal medicine, and my undergraduate degree was done in computer electrical engineering at the University of Tulsa. After that, I went to India and did my medical school there because my family was there. So after that, I went on and did my infectious disease at the University of Pennsylvania, which is in Philadelphia. And by seeing Dr. Anthony Fauci on television, it means a lot to me because he was one of our professors, and he would come frequently, and he works for the NIH, and we learned a lot from him. We continue to learn a lot from him. It is a pleasure to see him. I have been practicing infectious diseases in Florida right after my fellowship for approximately 26 years, and still have a few years left to go. COVID-19 is a viral infection known as SARS-2, which is a severe respiratory infection, and it is caused by coronavirus. And unfortunately now, it is a very deadly pandemic that has affected the entire world, and it has caused so much tremendous issues, which we are absolutely all working on right now. COVID-19 is a pandemic because it is an extremely large epidemic which started in one country, but then it started spreading to multiple different countries and then to different continents and now to the rest of the world. When such an issue occurs, that is called a pandemic. To develop the spread of COVID-19 doesn't require much. What it is essentially coughing, spreading of respiratory droplets, sneezing, and that's how again the respiratory droplets start moving. The hand contact where it can communicate through the skin, and sometimes it's actually the feces. These are the main methods from when one person has the infection in which way they spread it. But there is yet another big issue that we have to always think about, and extensive analysis has been done. The COVID virus tends to live on the ground. It lives on cardboard, it lives on the plastic, and it lives in steel. So apparently they have done a wonderful analysis. On the steel, it lives for about 4 or 5 hours. On the plastic and the cardboard, it tends to live a little bit longer. And on the metal and the ground, it lives for up to 72 hours. So now this is why, because of this style of spread, we do have to essentially sterilize what all that we can. This is part of my Infusion Center. So this is where we take care of our dear patients. These are patients that are referred to us directly, and patients come to us directly, and patients come from the hospital. So what we do is we administer these intravenous antibiotic therapy so they can avoid the hospitalization, particularly now with COVID. That's a big issue. So we follow our protocols in here, and the patients are coming every day, and they don't go anywhere else obviously because of this, so it works well. So the patient sits down here, and we go on ahead and administer the medication and work on it. And the patient comes and gets therapy for sometimes anywhere between 2 to 8 weeks, and then they gradually get better. So everybody's very happy with that, and directly we supervise next to the office. So the patient is never alone, and we watch and monitor closely. So it is an absolute pleasure to do that, and the patients like it very well as well. Vaccination is one of the most incredible, essential, necessary items I feel very strongly about. Vaccination is the administration of a vaccine to assist in the immune system of a live creature, could be humans, could be animals, sometimes birds, in order to help them to deal with an infection. Now, to communicate about the COVID vaccine, that would be one of the most important things that we can work on right now, and it already has started. The importance about administering vaccines, not only does it fix and help that one person, but when multiple people in communities get vaccines, it is called herd immunity. It helps the entire community and the herd to control that particular kind of infection. So what has happened to the rest of us currently in the world right now is we have never really experienced COVID before. But once it comes on to us and attacks us, just look at the amount of damage it does. But as time passes and we're more exposed to it, we do better. And if we take vaccines, we do even better. And then our herd immunity ramps up. Therefore, without a doubt, vaccines are absolutely essential, and the workup is very strongly underway. So to prevent any of our wonderful human beings or even animals from getting affected by this virus. I am very passionate about infectious diseases, and the purpose of me being this passionate about it is anything I can do and learn and educate and help our dear humans in the world and animals avoid any kind of infection. I am very particular about that. I strongly believe in making diagnoses, analyzing at great depth, and applying all that I learned at the University of Pennsylvania under Dr. Fauci and under my professors about how to prevent these type of infections. I am very passionate about being in a capacity to treat patients, and I take a long time. I communicate with them, and they're very intelligent, and I give them the guidelines. I show them that. I show them the results of their tests, and they feel very good about it, and it's almost like we treat it together. This is one of my delightful sisters. She's been with me for such a long time. She's helped my husband and me so much in our practice, and cannot thank you enough for all of what you do. Thank you.
I love you.
Thank you. After 26 years of practice, I have strongly believed in this more and more, and I communicate even more with patients. I tell them to always feel good about themselves, to always be positive, to never deteriorate themselves, to always work on their mind and to work on their immune system, to be strong, to avoid any kind of damage or any other issues which can reduce their capacity to have a wonderful life. So I feel I am very connected with the patients, emotionally attached to them, and when I can help them to do much better and to believe in themselves and to take care of themselves very well, I think they do extremely well. So I feel I'm a little bit different, rather passionate, and I enjoy what I do. When I went into medical school, I was really passionate about it, and that mathematics and the computer engineering that I had learned, I was able to, in a different angle, apply it for the medicine. And I was very fortunate. In India, I was able to come to one of the top 10 awards for several of the fields and subjects. And those are the awards that I got. And after that, when I came and started my practice in infectious diseases in Florida, there were 3-4 counties here which had a minimal infectious disease assistance. And so therefore, I absolutely got out there. And our HIV patients were not being able to take care of, and they had to go to Tampa or they had to go to Gainesville in order to get care. But I said, no, they can't drive like that. That's not fair to them. This is what I'm here for. So irrespective of any insurance or etc., I actually started taking care of them at the health department, worked there for about 11 years, and worked with them very hard, and started opening up a lot of those Ryan White fundings, etc. And they were able to finally get medications and get care. And the most wonderful thing is in 20-some years, they're still here, they're still my patients, they're still very well alive and doing extremely well. That gives me the greatest pleasure. So therefore, they were able to give me an award for that. And subsequent to that, I've been very fortunate. Over the years, I was able to publish a lot of my cases that I had done with several infectious disease societies and with the medical societies, and they were able to publish all of them, and that made a big difference, and that was a pleasure. After the practice, in all of these years, I have been very fortunate to get the WHO's award and the multiple awards, the IAOTP and the Carrington Publishers and the Top Doctor Award, Leading Physicians Award. So I've been very fortunate, and the most important part of that is how much more can I help my dear patients? How much more can I educate everybody? How much more can I give back to everybody? But as far as the military goes, they are brilliant in multiple different areas, and they go out there and they do their work irrespective of the reward, irrespective of the gain. They do their job, and there is nothing like that, and to me it's just wonderful and amazing. Having understood a lot of those things, and seeing the veterans when they have finished their training, they finished their war, and they've come back, I find it very tragic that they tend to have PTSD. They have damages of several parts of their body, and it's very difficult for them to completely fit into the civilian world as normally and as well they did the military. So therefore, I feel we as civilians, since we are here because of them, it would be wonderful to have them come back to us. And what all we are good at, I would like to apply it to them. So I went ahead and worked with a lot of wonderful people, and the Marine Corps, no words to praise them. Wonderful. Special Ops, Black Ops, all of them are incredible people. And I worked very hard with them, communicated with them, and wanted to start some sort of a company which would help them. And it is challenging. It is challenging to get everybody involved and do these things. So we started this wonderful company called the Veterans Empowerment. And we initiated it for a while, and we tried to get homes for the veterans, tried to get food for them. And I'm still working on it with them with some more veterans. And what I would really love to do is open a beautiful farm, and have them stay there, keep themselves busy, and they will continue to get better. And that's all that's important, getting them to get better. So it has been an absolute honor and a pleasure to be able to bring out all the infectious diseases that I learned at the University of Pennsylvania, and to be able to deliver to this wonderful community and several counties. It has really been an honor and a pleasure.
Dr. Sastry never gives up on her patients to come up with an accurate diagnosis and highly effective treatment. She says her whole purpose is to help her patients regain their health so they can move on and live happy lives. For Close Up Television and Radio, I'm Jim Masters. Thanks for joining us.